and today we're going to be starting a new 3-episode series on wisdom teeth. I know this is one area where you all have lots of questions and doubts, so hope I can address to all of those. We're going to be talking about what are wisdom teeth, what causes the tooth pain and trouble, the do's and don'ts, and a lot more. So stay tuned for all the episodes. Have any of you ever had wisdom tooth pain? If yes, then you know it can be really excruciating. There's a constant pain in your mouth and you will never be able to be at ease. There's pain while sleeping, while chewing food, and lots of other problems. And there's pain sometimes even while closing your mouth. So what are these wisdom teeth and why are they so troublesome? And how to effectively take care of this wisdom tooth pain at home? Coming right up in this video. So let's begin with a small introduction about what wisdom teeth are. So these are basically your last molars, both in your lower as well as the upper jaw. So a normal adult has got 4 wisdom teeth in their mouth. Have you guys ever wondered why wisdom teeth are called so? That is because they are seen to erupt at the age of between 8 to 24, and that's the age when a person tends to get more mature and wise, and hence the name. But why are they so troublesome after all? Well, the answer is because over the years, the size of the human jawbone has seemed to become smaller and smaller, and hence not all teeth are able to fit in completely. And the last ones to erupt, which are your wisdom teeth, they tend to be partially erupted or impacted, as we say. Now this can give rise to a lot of problems in your mouth. Because of its irregular or tilted position, what happens is the skin or the gum surrounding this wisdom tooth develops deep pockets, and food and debris tends to get accumulated in these pockets. And food and debris being a constant source of irritants, they give rise to swelling or inflammation in this surrounding gum. Now this swollen gum can give rise to a lot of difficulties in chewing food and even closing your mouth. And in the long run, if not treated well, it can give cavities not just in your wisdom teeth but also in the teeth surrounding it. So what to do if you're one of those people who is experiencing a similar problem? I'm going to be helping you out with 5 tips on how you can take care of your wisdom tooth pain at home. So let's begin. Tip number 1. Keep the area clean. A lot of us make this mistake because the skin is so tender, we don't like to brush over there and we tend to leave it out completely. But this is something that you must never do. The whole idea of treating your wisdom tooth pain is to keep that area clean and hygienic. So if you're not going to be brushing effectively in that area, your healing won't happen very quickly. So don't forget to brush, especially at night. Tip number 2. Use a medicated mouthwash, especially a mouthwash which has chlorhexidine. Now chlorhexidine has got great antibacterial properties. Now these antibacterial properties, they help in reducing the inflammation in your gums surrounding the wisdom tooth, and which further helps with your pain. Typically, I would advise using a mouthwash twice in a day after your meals. Tip number 3. Hot saline rinses. All you have to do is take a glass of hot water and dilute half teaspoon of salt in it and rinse using that water at least 4 to 5 times a day. Now what this does is the heat provided by the hot water increases the blood circulation in your affected area and thus helps in reducing your swelling. And salt also has got great antibacterial properties. So these two work wonders together. But an important thing to keep in mind with this tip is it's not something like a painkiller which will give you results immediately or say in 24 hours. This method takes a little longer to work. So don't give up on it so easily. Keep trying and at least give it 4 to 5 days to show some desired results. Tip number 4. Avoid chewing on that side. It's very simple, and what this does is that it ensures food and debris don't get stuck over there, and secondly, you're just ensuring that every time you bite, you don't impinge on that swollen tissue, which will further help in your healing. Tip number 5. If you have a swelling on your face externally, then you must use an ice pack. Just use a cold pack, leave it on for 15-20 minutes and remove it. You need to do this to ensure that the blood circulation towards your face is reduced and the swelling doesn't spread further towards your face, because if it does, it can have some very bad consequences if it spreads to the surrounding tissues. So keep this in mind. Now, all these tips that I have shared with you today, these are, I would say, symptomatic treatment. These are not definitive treatment. So this will definitely help you to treat the symptoms for now. But if you don't do a permanent treatment, your symptoms and the pain is going to come back. So ideally, when you have wisdom tooth trouble, you need to visit your dentist immediately. What your dentist will do is make a proper treatment plan that is best suited for your case. If you guys have already started wondering what to expect from your dental visits, what are the various different types of treatment options available, then stay tuned for the next video because I'm going to be answering those questions in that one. If you guys have any other such questions regarding your mouth and oral cavity, then feel free to leave them in the comments below and I'll try my best to answer all. Stay healthy and keep smiling.
And this is when your wisdom tooth is trying to come into the mouth, but it gets stuck halfway up. It just leaves an open pathway for bacteria and debris to get stuck under it. This is a problem because it leads to infection as the yeast inside decays. So what you want to do is flush it all out. You'll need a special syringe for that, as you can see here. And here's a quick video clip on how to do it. You use some warm salt water in a syringe and just shove it in there as far as you can without causing yourself discomfort, and then apply some pressure to the back syringe so that the salt water rinses out any debris inside of the pot. The second cause of wisdom tooth pain is a large cavity. Like any tooth, you can have a toothache on a wisdom tooth as well, and if the cavity is large enough and has reached the central core of the tooth, which is called the pulp, then a toothache can ensue where you have severe pain in that area. When it comes to a toothache, I'm going to give some advice that you really can't take as proper medical advice because it really depends on you and your medical conditions. There's so many factors, but if I was going to be recommending something to a super healthy patient that had no medications or no allergies, I'd be saying take 400 milligrams of ibuprofen and 2 extra strength Tylenol every 6 hours. They work really, really well together to control the pain. And the final cause of wisdom tooth pain that we'll be talking about today is supraeruption, which is essentially when a top wisdom tooth grows down too far or a lower wisdom tooth grows up too far. Typically, it's the top one growing down too far, and usually it's in the context of when a lower wisdom tooth has already been lost and the top wisdom tooth no longer has a partner to chew against. So what happens is if the wisdom teeth are over like this one actually was lost, the lower wisdom tooth is lost, and this one starts to grow down. And what happens is that if it grows down far enough, it'll start to actually impinge or chew on the gums below. And that can cause some severe pain as well if it's left long enough. Soft diet is the best thing I can recommend until you do get into the dentist. Otherwise, if you're chewing beef jerky or going hard on apples and stuff like that, it may be tough on the gums. Keep that in mind and see dentist as soon as you can, which is going to be the next part of this video. Now we're going to talk about what to expect at the dentist's office. So there's probably going to be a couple appointments involved, and the first one is almost always not going to involve the actual extraction of your tooth. So don't worry, you can sleep easy the night before the dentist. You're just going to go in and have a chat and get some things checked out. So the first appointment, we're going to be making sure that the wisdom tooth is not too dangerous to remove. Some wisdom teeth can be very close to the nerve of the jaw and temporary or permanent numbness of the jaw or tongue. So we want to make sure that you're not going to be dealing with those risks, and if you are dealing with those risks, we want to make sure that you're in the hands of someone like an oral surgeon who has a whole lot more experience in extracting wisdom teeth than the general dentist would. In order to assess this risk, the dentist is going to be taking something called a panoramic x-ray, or sometimes a CBCT, which is it's going to be hard to say, cone beam computed tomography, which is just a fancy word for a 3D x-ray, which is going to help the surgeon or the dentist understand in 3 dimensions exactly where your tooth is relative to the nerves and the sinus and all these other anatomical structures. Another thing your dentist will likely talk about is sedation. When you have wisdom teeth taken out, it is nice to be sedated. That's what I had when I had my wisdom teeth taken out. My dad actually did it for me through the dentist as well. And I got all 4 taken out. I had oral sedation, so I took a tablet about an hour before the procedure, and I had laughing gas as well. And it actually turns out to be a dynamite combination. I don't remember much of it at all. Little bits and pieces of it, but very, very straightforward. So for most nervous patients, this combination works really well, which is the laughing gas and the oral sedation tablet. There are more advanced forms of sedation out there. You can have IV sedation and something called general anesthesia, which is essentially when you get put out for surgery. If you do have a significant infection around your wisdom tooth, or actually in your wisdom tooth, the dentist may recommend antibiotics in the meantime until they do get you back for the extractions. This will just prevent any infection spreading from the tooth around the tooth to the face. Now, here's the word to the wise. Make sure that you don't get fooled by a false sense of security. Because what's going to happen is that after you start taking the antibiotics, you're going to feel amazing. A lot of people do, not all the time, but if you do, it doesn't mean that the infection is gone. It just means that the pressure from the infection has been mitigated temporarily such that you're not experiencing so much pain anymore. But it will come back, and oftentimes it's even worse than the first time. As for the second appointment, here's what's going to happen. If you are going the sedation route, typically the dentist will bring you in beforehand. At least that's how we do it in Canada. The dentist will give you the pill an hour before your procedure while you just chill in the chair, wait for it to take effect, and then
there may be some vibrations that take place, and you also may just feel like you have to open really wide. But again, most people who are sedated